Our interoperability platform, Discharge to Assess, sends electronic referrals from hospitals to Mosaic securely. With Discharge to Assess, social care and healthcare practitioners are alerted when information changes about a person they're caring for. It allows them to prioritize the right people quickly for discharge when they are safe to leave hospital, and reduces the risk of discharge delays. Hospital discharge is mandated by the CARE Act and was amended by the COVID-19 hospital discharge requirements. Let's take a look at Discharge to Assess in action. Mrs. Jones has dementia. She was receiving care in her home, but she had a fall and was taken to hospital. Her leg is broken, so she's been admitted and will need to stay there for a few days. The hospital can use the Care Data Service to check Mrs. Jones' current care package and understand her needs. Using Discharge to Assess, the clinician can refer Mrs. Jones to the social care service. The referral includes an estimated date of discharge and details of Mrs. Jones' current condition to start the process of planning for an assessment. The social worker receives all the relevant referral details electronically to prepare for the assessment. The good news for social workers is they don't need to phone around for information, as it is all visible in Mosaic. The digital referral is now linked directly to the hospital systems. It updates patient information such as ward location, medically fit status, and predicted discharge date. If a person dies in hospital, the involved social care staff get notified of this change instantly. Mrs. Jones can now leave the hospital, and when she's discharged, her social worker is notified. The social worker visits Mrs. Jones at home and carries out the assessment to ensure she has the support and equipment needed to recover. The assessments carried out by the social worker confirm that Mrs. Jones can live independently while recovering from her broken leg, with the support she needs. This ensures she is not staying in hospital for longer than is required, minimizing the risk to her long-term health. Mrs. Jones is more likely to be discharged from hospital quickly thanks to more efficient processes and reduced admin time to create a referral. By allowing her to return home sooner and receive care at home, Mrs. Jones receives the appropriate care in her familiar and comfortable surroundings, rather than in a hospital, reducing the risk of developing hospital-acquired infections. By delivering joined-up care, Mrs. Jones receives a better experience across health and social care and can be back home quicker with the support she needs. Discharge to Assess reduces the average time between health submitting a request and it being received by social care from hours to seconds. Social work practitioners can view the same data as their health colleagues and are made aware of any changes or updates as they happen in real time. This saves them time not having to track down people who have moved wards, for example. It allows them to prioritize the right patients for discharge when they're safe to leave hospital, and reduces the risk of discharge delays. As a result, the average length of a patient's hospital stay is reduced by 3.2 days. Get in contact with our team to find out more about how Discharge to Assess could help you, your colleagues, and your service users.